This first video is on anatomical movements, planes, and regions. So the first thing we need to talk about is anatomical position, which is facing forward, palms up, feet forward. This is how you would reference the bones in the body or organs or just how the body's laying when you're talking in an anatomy course. Regions. So the body is broken up into different regions using Latin, Greek words for things we would say head, forehead, back of head, arm, but they're going to have fancy words, which is like anatomy. Everything just has a fancier word than you know. So first we're going to talk about head, cephalic. So the entire head would be called cephalic, but the head's broken up into different regions. So you have frontal, which is going to be your forehead, occipital, which will be the back of your head, parietal, which is going to be the top section of your head, temporal, which is going to be the kind of side piece above your ear, and auricle, which is your ear. Auricular, sorry. And then facial, which is your whole face. Facial is then broken down into smaller pieces. So you have buccal or buccal, which is your cheek, nasal, nose, oral, mouth, orbital for your eyes, and mental for your chin. All of these are kind of self-explanatory, except mental, how I like to think of it, is the thinker, the famous statue with his hand on his chin. Since he's thinking, he's mental, so chin, mental. Next, you have your cervical, which will be your neck. Then we're going to go into your thoracic cavity. So your thoracic is just your chest. So we'll just say thoracic. Thoracic is broken into pectoral, so kind of where your pecs are. Axillary, which is your armpit. Mammary, which would be breast, so it's kind of broken down a little bit smaller regions than the pectoral. And then sternal, which would be kind of in between where your sternum is. Next, you have your back region or dorsal region. So you have your scapular, which is going to be on your shoulder, on the back of your shoulder, on top of your scapula. Vertebral, which is going to go down along your spine. And sacral, which is above your sacrum, sacral crest. Then, of course, you have your abdominal, which is kind of easier to know. You have your pelvic. You have your inguinal, which is kind of the area in between your thighs. That kind of makes a triangle. And pubic, where your groin is. Next, we'll break into the arm, the upper limb. So your shoulder is going to be your deltoid, just kind of like the muscle. You have your deltoid there. Brachial is referring to your upper arm. So your arm is this. So brachial. Then you have your elbow. So the front of your elbow, it would be antecubital. And then your back of your elbow is either cubital or olecranon, depending on what your teacher preference is how they're going to use it. Olecranon because you have olecranon process, and then I don't really know where they get cubital, but it's also used. So draw it right here. Olecranon / cubital. Sometimes it's easier to remember antecubital and cubital, and I just always remember olecranon. And then you have your antebrachial, which is your lower arm. And then you have your manus. Manus means hand. Your palm of your hand is called palmar. The back of your hand is the dorsum of your hand because the back side is dorsal, front side is ventral of the human body. So the back of your hand would be your dorsum of your hand. Digital is fingers. And your pollex is your thumb. Next we have legs, inferior rim. So you have your buttocks, which is gluteal. You have your glutes back there. Coxal is hip, which is kind of weird because you have your coccyx, which is the bottom of your sacrum, but coxal is going to be your hip region. So femoral, thigh, your femur is. Patellar is your knee, where your patella is. The back of your knee is your popliteal region, which is fun to say. Your curl is the front of your leg or your shin. And then your back of your leg or your calf is sural. I can remember these because it's curl to kick someone in the shin because it hurts a lot. And then you have pes, which is foot. And then you have your dorsum of your foot, which is the top of your foot. Plantar, bottom. Digital would be toes, same as the hand. And then your big toe is hallux. So you have pullix and hallux. And those are kind of all of the regions of anatomy. About directional terms and planes. So directional terms are how you would describe different regions or different parts of the body in reference to each other. So you have superior and inferior, which is kind of synonymous to above and below. So frontal is superior to sternal, or sternal is inferior to frontal. Then you have cranial and caudal, which is very similar. Get that in here. So you have cranial and caudal. So cranial, cranium, head, caudal, tail. So you would just describe it cranial as is towards the head or caudal towards the tail. It's very similar to superior and inferior. Then you have anterior and posterior, which is kind of front and back. So you have your anterior side and posterior side, which is also synonymous to ventral and dorsal. Ventral and dorsal. Also, anterior, posterior, ventral side, dorsal side, dorsal back, ventral front, anterior front, posterior back. Then you have medial and lateral, which means towards the midline, which would go straight up the body like this, or away from the midline. So the sternal is more medial to the deltoid, or deltoidal region. Then you have, so anterior, posterior, cranial, and caudal works for everything except for the limbs, because you can move your limb above your head and swing it around and do whatever, so it's not going to be in anatomical position. So when you're referencing the limbs, you would say proximal and distal. Proximal is towards the root of the limb, so towards the shoulder or towards the hip. So coxal is proximal to patellar, and deltoid is proximal to antecubital. And then distal is further away, so your digital is distal to antecubital, and your hallux is distal to your crural. And then last but not least, you have superficial and deep, which is referencing superficial is like your skin, and deep would be in your bone, so how deep it goes into the body. So your stomach is deep to your abdominal muscles, and then your skin is superficial to your muscles. Next, we're going to talk about planes. So a plane is a flat surface that you would kind of look through, like a sheet of glass. So when you're talking anatomy, in order to see some structures, you'll have to dissect in a plane in order to see it. So the first plane is going to be a vertical or longitudinal plane, which is like this, how we drew on the midline. So vertical plane, which can be like this or like this. A plane that splits into the right and left sides of your body is called a sagittal plane. Sagittal just means in half. Mid-sagittal means directly in the center, and then if I were to draw it over here, it would be a parasagittal plane. This plane is a frontal/coronal plane. It's going to split the body into anterior and posterior halves. Next, you have the transverse plane. Or horizontal plane, which is going to split the body in superior, inferior, or cranial and caudal. And then you have an oblique plane. And an oblique plane is kind of weird because it's just any plane that slices not in these three different ones. So most commonly would be like a diagonal plane, which would be considered an oblique plane. 2 hand movements. So supination, palms up, pronation, palm down. And then we can do flexion and extension. So I'll just use my finger. Flexion is decreasing the angle in a joint. So flexion, decrease the angle of this joint. It was 180, now it's 90. And then extension, increasing the angle of a joint. So it's at 90, extending it to 180. Hyperextension would be if I were to extend this joint past 180. So that's hyperextension. So we have flexion, decreasing the angle, extension, increasing the angle, hyperextension, increasing it past an anatomical point. Next, we have adduction and abduction. So I'll use my thumb. Adduction, ADD, you're moving your thumb in towards your body. So you're adding your thumb to your body. Abduction, you're moving it away. So you're abducting it or removing it. When you're being abducted, you're being removed. So abduction, away. Adduction, towards.